students, welcome back to my classes. Today we will start with the basic introduction of pharmacology. What is pharmacology? So, pharmacology is a branch of science which will study the effects of drugs on the living systems. It may be human beings, it may be animals. The living systems, what the drug is showing the effect on the living systems. That study is nothing but pharmacology. So, this pharmacology term is taken from the Greek word pharmakon indicates drug and logos indicates discourse or study of the drugs. So pharmacology is nothing but study of drugs. What is a drug? So this drug is taken from a French word which is called as drogue, which indicates a dry herb. So a drug is nothing but a substance which is present in the medicine that is used for the diagnosis, prevention, treatment and cure of the disease. So WHO, the World Health Organization, in the year of 1966, it has given a proper definition for this drug. Nothing but it is any substance or product which is intended to or which is going to modify or which is going to explore the functions of the pathological states or which is used for the benefit of the recipient. Coming to the divisions in the pharmacology, there are two major divisions in the pharmacology which includes pharmacodynamics and pharmacokinetics. So generally people get confused between this dynamics and kinetics. So pharmacodynamics, dynamic indicates power. What is the power of a drug? What is the capacity of a drug to affect our body? How it is affecting our drug? What are the mechanism of action? How it is doing some action in our body? That is pharmacodynamic. What the drug is doing to the body. Whereas pharmacokinetics is nothing but what the body is doing to the drug. Kinesis is nothing but movement. If you are taking something through your mouth or through the injections, what is happening to the drug in our body? So this pharmacokinetics involve the ADME properties. ADME, which includes absorption, distribution, metabolism and excretion. So you can remember pharmacodynamic, D for drug, what drug is doing to the body. Kinetics, KB, what the body is doing to the drug. So pharmacokinetics deals with ADME, absorption, distribution, metabolism and excretion, which includes from taking a drug into our body, how it is transported in our blood and how it is reaching the target site. Whereas the pharmacodynamics is nothing but the mechanism of action, how it is showing the efficacy, effect in our body and how it is showing the toxic effects in our body. So we will discuss some of the branches of pharmacology. First one is pharmacotherapeutics. So as the name indicates, therapeutics, whether it is showing helpful effects. Therapy is nothing but treatment. So the drug, whether it is helpful for our body or whether it is showing adverse effects to our body, whether it is beneficial or adverse, wrong for our body. So pharmacotherapeutics is a branch of pharmacology which is being defined by the Merriam-Webster, like it is a study of therapeutic uses and effects of drugs, which is a study of beneficial and adverse effects on our body. Chemotherapy. Chemotherapy is nothing but the treatment which is used for the treatment of the systemic infections or malignancy. Malignancy means continuous multiplication, like cancer, like that. So, if you are using the drugs for the treatment of the systemic infections or malignancy, which is causing toxicity to our body, those drugs are specifically acting on this malignant cells. So, then we call those drugs as a chemotherapy. The treatment with those specific drugs is called as chemotherapy. Generally, the drugs have been classified into two types. The first one are pharmacodynamic agents, nothing but which show the effect on our body, on our recipient. Whereas chemotherapeutic drugs, they are specifically designed in such a way that they only act on the parasitic or malignant cells in our body or on the recipient. They do not show any effect on the normal host cells. They show the effect on the malignant or parasitic cells which are present in the recipient. So what is pharmacy? Pharmacy is the art and science of compounding and dispensing the drugs. Compounding is nothing but preparing as well as giving them to the patients. A doctor knows only why the disease comes and what drug should be given. Whereas a pharmacist knows why the disease occurs, what type of drug should be given and how the drug is also prepared. So pharmacist plays a major role for the preparing of the medicines as well as for dispensing them to the patients. We will prepare them in the suitable dosage form and they will be administered by the persons who are being affected. Toxicology, the study of the toxin or a poison is nothing but toxicology. So, it is a study of poisonous effects of drugs and other chemicals, whatever we are using in the household or the environmental pollutants, agricultures, homicidals, whatever it is, how they are causing the toxic effect, how we can detect them, how we can prevent them, and how the treatment will be given to overcome that particular poisoned condition. It also includes the study of adverse effects of the drugs and how they are causing the toxic effect on our body. Pharmacovigilance is playing a major role in our pharmacy profession. So, vigilance is nothing but to keep a watch. So, where it is keeping a watch on? It is keeping an eye on the pharmacy drugs or the medical substances. So, pharmacovigilance is nothing but it is helping for the drug safety. So, WHO has defined this as the science and activities which are relating to the detection, assessment, understanding and prevention of the adverse effects of any drug and drug related problems. Clinical pharmacology. Clinical indicates if a study is done on the humans, then we call it as clinical pharmacology. So here we check both the pharmacodynamic and pharmacokinetic properties, what is happening in the healthy volunteers as well as the patients. So in this we can check the effect of a drugs as well as the safety of the drugs. So clinical pharmacology is nothing but the study of the drugs in the humans. So we have seen clinical pharmacology, nothing but the study of drugs on the humans. So if this study of a drug happens in large population, then we term it as pharmacoepidemiology. Ology is nothing but study of. Epidemiology, epidemic means large population. So the study of a drug in the large population is called as pharmacoepidemiology. Here we can know what are the benefic effects of a drug and what are the adverse effects that can be studied. So it is a bridge science, as I told. Clinical pharmacology is nothing but study on the humans. Here pharmacoepidemiology is study of the drug on the humans in large population. Pharmacogenetics. So if you are treating two different patients who are suffering from the same disease, the same therapy you have given, but the patient may respond differently. So why this happens is because of the genetic variation between these individuals. So pharmacogenetics is the study how and why the people respond differently to the drug therapy based on their genetic makeup or genes. So this video, I guess it gives what is pharmacology and what are the various branches of pharmacology. So as a pharmacy students, we have to know the basic terms which are being related to the pharmacy profession.